On this episode, we'll talk about having insulin resistance and hypothyroidism and getting weight loss surgery. We'll also talk about getting a hysterectomy at the same time as a gastric sleeve, and we'll talk about the best way to hide surgical incisions. Hello everyone, I'm Dr. Alvarez with Endobariatric.com. Welcome to episode 250 of the Ask Dr. A Show 250. Wow, just so quick. Thanks so much for joining me and sending me your questions. You are always welcome to send me your questions, and there is one way to do this, and it could be on the comments down below. Just one big favor is use the hashtag Ask Dr. A throughout social media or on the comments down below, and we're able to grab those questions, add them here to the show. I'll be more than happy to answer them for you. And if you're looking into weight loss surgery, gastric sleeve content, you might consider hitting that subscribe button down there. That way you don't miss out on any of our future episodes. So without further ado, let's get into the show. All right, so the first question is, I have insulin resistance, I have hypothyroidism, and can I get weight loss surgery? Can I get a gastric sleeve? And the answer is yes. But your hypothyroidism needs to be under control. And it's actually a good indication of getting weight loss surgery. Your insulin resistance gets way better, or your diabetes gets way better. And it is an indication toward weight loss surgery if you are overweight. Your hypothyroidism is a condition that is completely independent from weight loss surgery or its results. In other words, getting weight loss surgery, once you lose all this weight, will it make your hypothyroidism go away? The answer is no. It may require for you to readjust your dose because your mass, you're shrinking. Less mass, less dose. But for it to go away, no. Although your insulin resistance may go away. That is why it is an indication. Now, your hypothyroidism needs to be under control. That means you need to already have your diagnosis that, in this case, this patient already knows because they're writing on it. They're letting us know that they do have hypothyroidism, and therefore I assume you are taking a medication to control it. But if it's under control, if it's hypothyroidism by itself, can you get weight loss surgery? The answer is yes, if it's under control. If you have insulin resistance as well, and boy, you get great benefit out of weight loss surgery. Okay, second question is, can I get a hysterectomy done at the same time, at the same surgical procedure as my gastric sleeve? And the answer is no. That is a no. Normally, procedures that we do at the same time as with the gastric sleeve is either a hiatal hernia repair or a gallbladder procedure when patients know they have gallstones and they've been having trouble with the gallstones. So in that case, we do the gastric sleeve and remove the gallbladder, or if we encounter a hiatal hernia, we fix the hiatal hernia. Other than that, pretty much nothing else is done. Even though you might think, well, hysterectomy, yeah, the uterus, it's in there, it's still inside the abdomen. Why not just get it out at the same time? Because I need a hysterectomy, but I also want to lose weight. I want to get the gastric sleeve. But no, it is completely opposite. I mean, it's the North Pole with the gastric sleeve, at the South Pole down at the pelvic area with the hysterectomy. No, it's just asking me, I would like to get a gastric sleeve done and get my tonsils out at the same time. No. We're not there for the tonsils. We're there for weight loss surgery. We want to have a short period of surgical time. Therefore, we avoid any complications. We get you up and going, and 25, 30 minutes, we finish the procedure, and you're up and about and recovering. That's what we want. We don't want a patient who is overweight for long periods of time in the operating room. Okay, and third question is, what is the best way to fade surgical incisions? Well, let me tell you that first thing is don't expose them to sunlight. I mean, don't expose your scars to sunlight, specifically those first 6 months, because while they're healing, they grab the UV rays, they grab a different pigmentation than the rest of your skin, and they're not going to fade. They're going to look different in a different tone. So try to avoid sun exposure on those incisions for the first 6 months. The other thing is you might want to use creams, ointments dedicated for this. Skin Guard is perfect. Mederma is perfect. The only thing is with these creams, you need to be a little on top of things at least twice a day for some 8 to 12 months, and it does help tremendously. It does fade them out. All right, so there you have it. That is it for episode 250. Send me your questions, please. If you liked the content, and only if you liked the content, if you can leave me one of these, I greatly appreciate it. Helps us out to get this content out to more viewers out there. And don't forget to send me your questions. Don't forget to use the hashtag AskDrA down here in the comments below. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.